Frankenstein charging. We're gonna try her charger.
Okay, so it's my working time right now, gentlemen, if you don't mind. Sorry, everybody. I have a guest in my house, and also, my IT guy is also here. All right. So the first thing is everybody received a study guide already? I just posted. Sorry, just being a little bit delayed because I have a busy morning.
Yes.
Yes, you got study guide, right? Okay.
Yes.
20 question, okay. So I draw all the question from the ATI again, so that's why we can practice the ATI. So most of the question it's kind of like almost like a 70%. They are kind of like a very like a touch on your base, so not difficult. But some question could be a little bit tricky, so that's why I will kind of like explain it, okay, by your study guide. Okay, so you can catch a note if you want. And today you can see it's a little bit different is, and so my IT person and he kind of like helping me. So you can see what I'm talking right now, and I have underline here. Okay, so in case it was somebody you cannot see, you cannot hear what did I say, so you can go in back and to check. So what did I say before? And if it's not very clear, sorry for my pronunciation. Okay, just ask me the question again. All right, so can we start right now?
Okay. Yes.
Okay, wait a second. Sorry, I'm not an IT person, so. Here, let me share the monitor here. All right, can we see the study guide here?
Yes.
Okay,
Yes.
cool. Okay, I will try to finish it soon. That's why you guys can go back to get some rest. Okay, because you have a clinical rotation tomorrow. All right, the first question is a diabetes diagnosis test. Okay, we do have a lot of diagnosis tests, right? But for the diabetes, so have you still remember how many we had? Checking the diabetes? We have many,
Nope.
right? Like a fasting glucose and like a
Hemoglobin A1C.
yes, hemoglobin A1C is the most of a correct, accurate one. Okay, that one is the one I want you to choose. Okay, if in your question they have this answer, the most accurate one is hemoglobin A1C. So pick that one because that one, the diagnosis patient cannot see. So it's kind of like a checking your red blood cell, the surface. So how many glucose on it? So it can be go to like 120 days. No, means which is like 4 months as a max month. So that's why we are going to see how is this kind of hemoglobin and on the surface how much blood sugar retained. So that means that the patient is controlled by the blood sugar within this whole 4 months. All right. Here, the second one, metformin common side effect.
Diarrhea.
Diarrhea, yes.
GI upset.
GI upset, yes. Also one more.
Lactic acidosis.
Yes, that's good. I didn't really touch about like a lactic acidosis because it's kind of like an RN label. Okay, so very good. You know lactic acidosis. That's very good. But in your LVN label, you can know it. That's good to know, but not really like a side effect you have to know right now. So I need you to know another common side effect is that when we're taking the metformin, so what will happen? The patient will going to complain to you. They're testing something in their mouth.
The metallic taste.
Metallic taste.
Yes, metallic taste. Okay, that tastes like metal. Okay, so that means the patient will tell you, okay, I taste bitter and also like a different tastes. Okay, so this is exactly when we're taking the metformin and also taking like a COVID-19 Paxlovid. They both have this kind of side effect. Okay, just tell the patient don't freak out. This is normal. Okay. Number 3, the patient is taking the glupozide. So what kind of like why the treatment is not working? So usually when you see the patient's symptom or some kind of like a lab result is not improving, most likely is why. Remember I said this is very important.
The
Why?
drug isn't working.
The patient's not
Why?
compliant with the medication.
Yes. So the patient cannot comply with the medication. Okay, so that means what the patient maybe is not taking the medication, or either way they're taking the medication in the wrong way. That's why you need to find out, you need to do some assess and asking the patient, let me know how you're taking this medication, please. So are you taking like what dosage you are taking in the morning or afternoon? And you're taking with some kind of like other food or with some other medication. Sometimes the patient is still taking the medication, right? We don't want to doubt it. But maybe they're taking some other medication, it's kind of interaction. That's why we're making the medication decrease the effect. Okay, so that's why you need to do some assessment, see how is the patient comply with the medication. Number 4, the patient is on oral diabetes medication and is missing the meal. So what should we do? The
Hold the
patient is
medication.
if the patient is taking the medication already, we cannot hold it anymore. Yes, that's very easy. Don't think too much.
Wait with the patient.
Check the blood sugar.
The patient
Wait
is
and watch them eat. No?
the patient missed the meal. They did not eat.
Take the medication as
Give
soon
them
as you
some medicine, food. I'm sorry, give them some food.
Yes. Force them
Oh,
to
yeah.
eat right now. Sorry. You just take a medication. Either way, you take I don't care. You take an oral, you take an injection. I really don't care. As long as you're taking the medication, this medication is control your blood sugar. That means the blood sugar is going to decreasing, right? So that means what? I need you eat right now. I really need you eat, and I need to see you are eating right now, cause you're gonna have like a hypoglycemia shock. Okay, the blood sugar is going so low, so I don't want that happen. So I need to eat, and I will give you something to eat or drink, and I need you to have a sugar right now in case your sugar is going too low. Okay. All right. Number 5 is the oral diabetes medication working on type 1 diabetes. Wait a second. Let me. Can I go to your room and that's why I can teach my student? Sorry, I'm moving. Okay, guys, because I cannot hear. I cannot hear very well. Okay, you guys stay here. I go upstairs. Hugo, now come. Don't come. Stay upstairs. All right. Okay, I'm back. Sorry for the interruption. Okay, so number 5 is the oral diabetes medication is working for the type 1 diabetes.
No,
Why not?
just say
There's
no.
insulin coming out.
There's no insulin, yes, because their beta cell is all destroyed. It's not working already. So the oral medication that is kind of like a stimulate your beta cell release the insulin, but there's no beta cell for them anymore. So there's no way they can release any insulin, right? So that means what? The type 1 diabetes patient, for sure, they need an injection. They need an injection for sure. So that's why the oral medication is not for the type 1 diabetes. Okay, remember this. So when the type 1 diabetes patient tells you, say, why I cannot take oral medication? Well, I'm sorry, sir, because it's not working for you. You have no beta cell in your pancreas. Okay, your beta cell is all destroyed. This is the reason. Okay, since when you are born and they are not active, that's why we have to give you the injection. All right. The number 6. Human law. So, nursing intervention. The most important things. Okay, what is a human law? Insulin.
Rapid action. Rapid
Rapid
acting.
acting.
Yes, very rapid. Okay, for how long? Rapid.
Onset 15 minutes.
Yes, this is what I want to hear. 15 minutes. So the most important thing is about what? So if I know this is like happen in 15 minutes, so I need to see patient doing something.
Eating.
Eating.
Yes, eating. Good. Okay, never forget this. Okay. So when the patient taking the diabetes medication, I don't care it's oral or like injection. So the most important thing is that when I give you this medication and I need to see you eating, I need to see your intake. Okay. So that's why having your CNA assess the patient eating, I'll just checking if the patient still they are eating right now. Okay, because human law and the normal law, this both medication acting like within 15 minutes. 15 minutes. So it's very fast, very rapid. So that's why you need to make sure patient is eating or it's going to be cause a hypoglycemic shock. Okay, the next one. The number 7. The reason why we need like a rotation injection site for the insulin.
Prevent lipodystrophy.
Yes. To prevent this kind of like a dystrophy, okay, the lipo dystrophy. So that's why we need to rotate all the different injection site. So be careful. They're going to tell you, okay, because it is kind of like a prevent like a absorption too much or like a decrease the absorption. No, that's not the main reason because the lipo dystrophy, and that means sometimes will decrease or increase the absorption for the insulin. It doesn't matter increase or decrease. We just don't want that. We just don't want to happen. All right. How can we store with the insulin properly? The insulin.
Room temperature.
Okay. So
Refrigerator.
refrigerator. Okay. So if this insulin we storage in the refrigerator because this is kind of like a protein, right? Yes. When we want to use and we just put it in a room temperature for like maybe 15 to 20 minutes and then we inject. In case insulin is too cold, so when we inject the patient, it's kind of too cold. They don't feel comfortable. Also, because it's a cold medication will increase the lipodystrophy. All right. So if this insulin is not open yet, for sure this insulin need to be stored in the refrigerator because you're not using it yet, right? So that means what? All the insulin, the liquid insulin. So that means the vial one, even the Ozempic, Trulicity, I don't care because they're also insulin. Okay, so that's why they all need to put it in a refrigerator. So can I just leave it in the kitchen?
No, because it's too hot.
Yeah, we say that many times. Okay, kitchen is the area for cooking. It's not an area storage with your medication. Okay, your medication need to be stored with some kind of like a room temperature, not too hot, not too cold, not too humid, and also it's a good exposure, not under the sun or not just like under the ice something. So insulin is good in the refrigerator, not good in the freezer. Please do not put in the freezer. So they are going to become like ice. All right. Okay. So the next one. How should we check the blood sugar after the insulin give? Why should we check the blood sugar after insulin giving? Well, this one
To
is very
make sure
easy.
it doesn't drop too much.
Yes, prevent a hypoglycemia. Okay, so this one is very easy. All right. So number 10, insulin and alcohol relationship. So that means what? The patient is receiving an insulin and the patient also drinking. So what will happen?
Hypoglycemia.
Hypo. Yes, correct. So in alcohol actually was helping the insulin. Okay, not just taking too much sugar will suddenly drop. Okay, alcohol is kind of like a double effect to the insulin. So this is the reason that's why you cannot just drinking and also use insulin or either way oral medication. So alcohol have this kind of effect. So be careful. That's why we do not let the patient. Okay, patient will tell you something very dangerous. So when I was eating and then I also drink one glass of wine and then I just inject myself the insulin. And that will be trigger your nerves. Excuse me, did you just tell me and you just drink the alcohol and also inject your insulin in the same time? No, let me check your blood sugar right now. I'm sorry, I'm very worried about your blood sugar is going low right now. So be careful, okay? Do not use the alcohol and mess with the insulin and taken together. Number 11, insulin management for the surgery patient. Okay, so when the patient going to the surgery, do we still give it insulin?
Yes.
Yes.
No.
Yes,
No.
usually yes.
No.
We check the blood sugar, okay, first, okay, and if the blood sugar is not too low, usually we still give the insulin. Why? Because surgery is a stress, so the stress will trigger your corticosteroid increasing by your adrenal gland. So that's why usually when the patient is going to the surgery, okay, before and during and after the surgery, usually the blood sugar go higher. So this is the reason we still give some insulin to control the sugar is not going to be crazy high after the surgery. Okay, because after the surgery, if the sugar is high and we cannot give insulin right away, why not? Because after the surgery, the patient have a lots of medication inside the body. For example, like anesthesia and also pain medication. So that's why if insulin mixed with this medication together have some interaction, we don't want it. We don't want it. Okay, so hypoglycemia shock and is because caused by the insulin, and also anesthesia shock. Okay, patient is not awake. So how can you know which medication causes the patient is dying? You don't know, right? So this is the reason. After the surgery, the patient in the recovery room, usually we don't give insulin. Even the sugar is high, we just monitor. So this is the reason. Okay, insulin management for the surgery patient, we still give it. We still give the patient some insulin. Okay, and we also monitor. Number 12, NPH insulin administered proper method. Okay, how can we just give an NPH this medication? NPH this long-term medication also was from your refrigerate. Okay, before we give this medication, we need to do one thing.
We have to mix it, but only rolling the vial.
Yes, rolling the vial, okay, between your hand, okay, and gently rolling, okay, please do not shake it. Don't shake it because you're gonna miss the lots of air bubble inside this insulin. So when we draw the insulin, we're not gonna draw very accurate dosage. Sometimes you will draw the bubble, will draw the air very easy. Okay, so that's why just gently rolling and just leave it on the counter, maybe like 5 to 10 minutes, and just wait the insulin in the room temperature. That's why you can draw it. Okay, all right. Number 13. This is a super famous superstar medication question is asking you. The step of NPH insulin mixed with the regular insulin. You still remember the step 1, 2, 3, 4, 5?
Yes.
Okay.
Yes.
What should we do first?
Air into MPH.
No, clean with alcohol swab.
Yeah, you can do that. Yes. Good.
Then
Clear before
Uh,
cloudy.
put the
Uh,
air to the
We put the air first, right? So
yes.
we put air. So these two vial right now. One vial is NPH, another vial is a regular insulin.
Regular.
So
Clear.
which air we put first?
The cloudy one.
NPH.
Yeah, cloudy one, NPH first. And then we put more air. We draw another air and just put the
clear one.
clear
Uh-huh.
regular insulin. Okay. And this time when we inject the air, do we draw or not?
Yes.
Yeah, we draw the clear
We
first.
draw,
and then-
yeah, we draw
and
the
then mix
clear.
with the cloudy.
Yeah, we draw the clear, and then we just check the dosage, and then we go to draw the cloudy one. Okay, that will be the whole syringe of insulin. Okay, so I've been checking with the ATI question. Be careful. Okay, I picked some kind of question, and this question here in the canvas here, this is the easy one. Okay, they do have lots of difficult one for this kind of step 1, 2, 3, 4, 5 missing with the insulin. So I'm gonna tell you the correct step right now and what I saw from ATI. So that's why you maybe can just put on your note. Okay, so the correct step for how we are drawing with the NPH and also the regular insulin is the first thing is please verify with your provider's order. That's what they want. I know this is kind of silly.
Oh.
Yeah, it's very silly, right? And of course, we check the provider order, right? We check doctor's order, right? But they want to see this one first, okay? Verify the provider order and also verify with the patient's name and the medication. Check with your insulin label. This is what they want to see first, okay? And in the between, maybe they were asking you, go to wash your hand and also use the alcohol clean your vial. And also one ATI question was asking you, okay, before you give the insulin to vial, checking the vial if any vial is breaking or leaking. Okay, yeah, this is also a little bit silly. Okay, of course you are checking, you are seeing before you draw, right? If it's leaking, of course you're not going to use it, right? But they want you make sure you do this. Okay. And then you all know the step, okay, we just draw the air and just inject to the MPH first, and then we draw the air again and inject to the regular, and then we draw the regular and we draw the MPH, okay, and then we inject the patient with the whole syringe with the insulin, right? And after that, we cannot done, right? No, the ATI not done yet. They're asking you after you inject this insulin and please come back to recheck patient's blood sugar again. Yeah, prevent the patient have a hypoglycemia. Okay, they want you to do that. So did you just catch it with all the steps like this? So we're kind of like talking about in the middle of a step in the class. So before like washing your hand or just checking the vial and verify doctor's order, we didn't say that. Okay, and also after that and just check a patient's blood sugar, we didn't say that. But of course we are gonna do this, right? But just let you know, okay, N class want you do step by step very carefully. Okay. So not surprised, right? The anchor is just like this. Okay, the next one. So number 14, GLP-1 medication. Okay, the mechanism. How is a GLP-1 medication working?
It stimulates the insulin release and slow gastric emptying.
Yes, we have a three method, right? So one is slow empty the GI system. It can slowing down kind of like your digest system, okay? And the second thing is will decrease the hunger, the desire, decrease the appetite from your brain. Okay, your brain is gonna be start with sending this kind of signal. Okay, and the third one is will release some more insulin from your beta cell. They have a three method. So this is the reason GLP-1. This is also injection insulin medication. But why the type 1 diabetes is not good to use this? Because type 1 diabetes, the patient, they do not have a beta cell active anymore. So that's why if you want the beta cell still release some more insulin, so GLP-1 medication is not good for the type 1 diabetes either. Okay, so this is the mechanism. Okay, so that's why they're asking you this question is how is this three mechanism? That's why remember this three is going to be your answer. All right, number 15. Okay, I-131 medication. Okay, is contraindication for the pregnancy woman. Why? I just give the answer here, okay, because I forgot to talk about this. We know it's going to be harmful for the woman, but how is it harmful? Because it's radiation medication actually will cross over the placenta, effect to your baby. Okay, that's why baby will kind of like receive this kind of radiation easy. So this is the reason that's why you don't touch this medication by the pregnancy woman. Okay, and this kind of like I-131 radiation will also affect to the baby in the placenta, their thyroid gland. Yes, so that means the baby will born with a hypothyroidism. All right, we good? Number 16.
Yes, we good.
Okay, 16. So I-131 therapy with a hypothyroidism. Okay, What happened? Because when we use this medication, okay, we're kind of killing some kind of extra thyroid cell, right? So that's why we don't want to keep releasing with the thyroid hormone. Okay, but when we use the medication, we can killing also irritate your thyroid. So that's why, unfortunately, thyroid from the beginning they just suddenly release too much thyroid hormone. So that's why cause the hypothyroidism. So we want to treat the hyperthyroidism, but now it's even more hyper right now. So what should we do? Well, it's not difficult. Can we give some more anti-thyroidism medication? Maybe like other anti-hyperthyroidism. The other anti-hyperthyroidism medication. Can we do that?
Yes.
Yes. Yes, we can do that. Yes. So just remember this, okay? I know you're going to cause like a hyperthyroidism, even hypo. If it's kind of showing hypo, that means what? This medication is working. That's why it's just successful killing some kind of like a thyroid cell, right? But if it's going hyper, it's also expected. So that's why I still can use medication to control it. Okay? All right. 17. How can we take a levothyroxine, this medication?
Take in the morning.
Oh yeah, in the
On
On an
morning,
empty stomach.
like 30 before the meal, 30
Yes.
minutes to 60.
Yes, that's all correct. Okay. In the early morning, empty stomach, before the meal, 30 minutes ago. Okay, this is all the answer. All right. So number 18, Cushing syndrome, the tapping glucocortisone. The reason why we tapping it.
Hmm?
The reason why we tapping it. The tapping on and tapping off. For the Cushing syndrome, actually, we are for this patient, we are tapping off. Because if we suddenly stop this medication, what will happen?
Oh,
It'll become another disease. Did you see number 20? What disease?
20?
Addison's.
Edison?
Yes,
Addison's.
because if we suddenly stop the corticosteroid, will cause the patient go to another crisis called Addison crisis because there's no steroid immediately, right? No steroid immediately. That's why a patient will go to the Addison crisis. Okay, so Addison crisis is about what? It's about adrenal gland inefficiency. That means that decrease the adrenal gland function. Okay, got it? All right. Number
Yes.
19. Cushing syndrome user glucocorticoid should monitor for what? This one is easy.
Hypoglycemia,
Hyperglycemia.
Yes.
Infection.
Blood sugar,
the weight gain.
yeah, that's all good. But for this one, the glucose, okay, we monitor glucose for sure, okay, and other maybe like infection or like some other thing or breathing episode, okay. All right, Addison disease to carry extra glucocorticoid reason. Why didn't they carry with this? Why this is emergency medication for them? This is Addison crisis.
To prevent adrenal crisis?
No.
They have
Cortical. No.
Yeah, you're kind of right. Prevent
hypotension, adrenal
hypotension.
crisis.
Adrenal crisis, yes, it's adrenal crisis. Yeah, so want to prevent when a patient suddenly is under stress, okay, will have like a adrenal crisis because they cannot release any hormone, like a adrenal hormone. Okay, so this is the reason. Okay, if a suddenly patient have some kind of crisis, for example, okay, patient just suddenly just worry or they just in a cloudy area, and the patient just trigger their anxiety, or either way, maybe they suddenly just have some pain. So that's why suddenly they have the body cannot just deal with the stress. That's what will cause like adrenal crisis. So this is the reason patient will tell you, okay, I don't feel good since my blood pressure is going low right now. I have some kind of palpitation right now. So that means it's kind of crisis already. Just tell your patient, okay, do you have the steroid medication with you right now? Can you take one right now? All right. So this is all the 20 questions. Not too difficult, right?
Yes.
Yes.
When you see the
Easy.
Not
question,
It's
difficult.
hard, it's too
Just so
hard.
easy.
yeah. When you see the
Not
question,
hard.
you're gonna give me a different answer. You say, no, it's not easy what you say. I don't understand the
It's
question.
hard.
All of
No,
us,
it's
all of
not.
us 100% get.
Yeah,
All
I
of
gotta,
us.
I gotta choose a little more easy question from the ATI. So that's why. So some question maybe I will still remain when you take in like a ATI next time, okay? But some question will be changed, okay? But most likely all these question is kind of like a 0.1 question. So that's why it's okay. Don't think too much, okay?
Don't worry.
Yep.
We are very simple.
You will be fine. You will be fine. Okay, you will be fine. All right. So then let me call a attendance. Okay, let me go get a piece of paper. Wait. Oh my god. Jimmy, your room doesn't have any pen.
Maggie.
Where's a pen?
Sue,
Oh,
I love you.
I love you too. Floriso, I love you too. Yuri.
I'm right here.
My best friend.
My bestie.
You go out. Out. All right, so let me stop sharing. Oh, okay, so I have a Jeffrey here, and I have a Joyce, and Maggie, and Floriso, okay. And I have a Melina, and who is OLO? Oh, sorry. Sushi. Sylvia. And I have a Alice. I have a Vanessa. Uriana. And Yuri. Alright. So who is the OLO?
It's me after.
Oh, Oscar? Okay, sure. Thank you.
Oscar.
All
I
right.
knew it.
I knew it too.
I don't know. Sorry. All right. So you guys can go. Okay. So have fun with your clinic tomorrow.
Thank
Oh, we
you.
will.
Okay.
Thank
Have a
you.
good night.
Night.
Have a good night.
Bye.
Bye.
Thank you,
Thank
Mr.
you.
Patrick. Have a good night.
You
Bye.
too.
Patrick.
Thank you.
Bye.
Thank